In a hope to combat the increasing infection of HIV virus, the World Health Organization is advocating for the use of pre-exposure prophylaxis to prevent infections, which include all population groups at substantial risk of HIV infection. As of last year, the World Body recommended that people at substantial risk of HIV infection but not HIV positive be offered prophylaxis as part of comprehensive prevention. Pre-exposure prophylaxis can be taken orally using an antiretroviral drug available for treatment of HIV infection. But as much as this could be an ideal to end new infections, implementing this recommendation will be a burden on the state, says Health and Social Services Minister.
It costs a lot of money to put people on or to buy this medicine. Number two, it doesn't really make scientific sense in medical terms. You can as well put everyone on TB treatment because we have a high load of TB. You can put everyone on anti-diabetic because there's a 7% prevalence of diabetes. You know what I mean? It has to be targeted. Information first, treatment second.
Dr. Bernard Haufiku said pre-exposure treatment could also compromise and leads to people not taking personal responsibility over their health.
We need to instill responsibility among families, friends, and young people to take charge of your own life. In the end of the day, that's what matters. We can't absolve ourselves totally from personal responsibility.
There is also fear of drug resistance, which could happen when a person is taking drugs that the body may not need.
But it has to be clearly indicated that you need this type of medication. That's the nature of medicine. Otherwise, we create a very large pool of resistant medicine that will not work because viruses change to the extent that medicine no longer become effective because the virus is a living thing.
In 2011, the government was spending $1,000 every month on a single person for HIV treatment, and to date, there are over 100,000 people on ARVs. In accordance with Namibia's current antiretroviral therapy guidelines, prophylaxis is only approved for couples where one partner is HIV positive.